Hi, and welcome back to the channel. Well, tonight what we're doing is we're having a few seminars, CPR seminar and stroke seminar. Stay tuned.
My name is Kathy Cash. I'm the stroke coordinator at Eisenhower Medical Center, and I'm going to just talk about stroke. The takeaway is early recognition of stroke. So the key is that these symptoms on this BFAST is what tells you these are the signs and symptoms of classic stroke. All right. So B is for balance, sudden onset that they can't walk, or they have clumsiness, or they're dragging their leg. That's the first one. E is eye. Eyes are for they suddenly can't see, like they can't see half the room. If you put your hand over your eye like this is what they see if they have a sudden onset of stroke. Or they can't track you. They can't move their eyes from side to side. And then there's F for face. So face is a smile. So if you have somebody smile and you notice that they're only half their face is going up like this, then there's something wrong. You can ask them to smile and see the number of teeth on both sides. If they're unequal number of teeth on both sides, and that means that there's something going on. And then they could be drooling. So arms, A is for arms. That is a sudden onset of weakness or flaccidness, or they can't move their leg. And then speech is, and S is for speech and a sudden onset of a headache. So speech is they're slurred, or they won't speak, like suddenly they can't speak. That means they've got some kind of brain damage going on. And then T is for time to call 911. So why do we want you to call 911? For one thing, the sooner we get to you, the sooner we can stop the progression of the stroke. So if there's a clot that goes up into your artery and it stops the flow of the blood to the brain, what happens is the brain tissue begins to die. And around that brain tissue that's dying is what we call the salvageable tissue or the penumbra. So we want to save that. So the quicker we can get you to treatment, the quicker we can save the brain tissue and reduce the deficits. So when you call 911, they will come and they will stabilize the scene and the patient, okay? They'll take their vital signs, but one of the most important questions and information that you need to know is when was the last time you saw this person normal, okay? So let's say 30 minutes ago, they were fine and you came to check on them and now they weren't fine, okay? That's important information. And what did you see? What's going on with them? If any kind of history that you have about them is important, that the paramedics are only going to be on the scene in a very short time. One thing they will do is a blood sugar, because a blood sugar can mimic or fake a stroke. So if the blood sugar is low or hypoglycemic, that means they may not be having a stroke. So they may correct that in the field and fix the blood sugar and then evaluate the patient. They'll probably still want to transport, but while they're doing all of that, they're going to be calling the hospital and saying to the hospital, we have a code stroke. And then what the hospital does, the emergency room, is they activate the code stroke. And so we have a whole process that we go through to activate the team. So the team gets there. And so the reason why we do that is because we want to get them in to get the CAT scan, the imaging, so that we can give them the clot buster drug, okay? We only have a very short period to give it from the time of onset.
Give it, what did you call it?
It's called the clot busting medicine.
It's fairly new, right?
So the key is be quick, recognize it, don't drive the person. Remember that 911 is not just a ride to the hospital, but they will start care and they'll give you some recommendations. So right here, this sheet here, this is recognizing a stroke. So the next thing is preventing a stroke from happening. So the biggest cause of a stroke is hypertension, right? So what I tell people is that hypertension is caused by too much salt, not controlling your blood pressure, not getting enough exercise, not keeping a healthy weight, eating healthy foods, no smoking. If you smoke, don't smoke. Alcohol moderate. But I tell people if you do all of those things, then your blood pressure will be stable. So you want to make sure you follow your doctor's advice, make sure you take your medicines. And the one thing is a stroke can happen to anyone, anywhere, at any time. So, but you don't want to set yourself up for a stroke. So some people will say to me, well, if I do all those things, I won't have a stroke. And I go, well, we can't guarantee that.
Well, genetics play a role too. I think.
Genetics is a big thing. Yes, that's right. Yep, that's right. That's why they...
strokes run in my family.
Yeah. So that's why when you go in to see the doctor, they ask you, so does your family, your mother, your father, everybody, your family, do you have a history of stroke, cancer, that kind of stuff? That's because it can be hereditary. So these are the lists of different types of risk assessment. Again, there's actually a fast. It's similar to the B-fast. We put B-fast on here because the first two are signs and symptoms of a posterior stroke, which is in the back of the brain, and so oftentimes is missed. So fast is what they started with, and then they moved to B-fast. And if you want to know about cholesterol, here's some flyers on cholesterol. If you want to learn about stroke more, you can go on to the American Heart Association stroke website or the American Stroke Association, and they have a ton of information.
You know, something almost every RVer has is an animal. I have my little rat, and I have a cat. But we need to protect our animals when we're not around. This symbol up here tells the fire department or anybody that you have an animal inside. It even specifies cat, dog, or other. It's great because if there is a problem, they know to get in there and rescue your animal. There is a link to these, and the nice thing about that is that it is UV protected, so it doesn't fade out, and it also is not adhesive, so if you want to take it off, it just comes off super easy. Remember, we want to protect our babies, so get one of those and let the fire department know that you have a baby inside.
And these are the same AEDs that we have in the complex. So you know where our AEDs are?
You told me earlier, they're in the restrooms?
No. They're in the 3 satellite swimming pools. So phase 2, phase 7, and phase 1 swimming pools. They're on the pickleball. There's one on the pickleball court, and there's one in the guard shack. And then there's one on my lot, 151. Yeah. Okay. All right. Okay, Cece, give it a shot. Let's see what happens.
Okay.
So you're going to pull that. Nope, pull the green. Just the green handle. Yep, and turn it on.
Pull it
Pull it all the way off. Go ahead and push the green button and turn it on.
Begin by removing all clothing from the patient's
all the clothing's removed.
Cut clothing if needed.
See, it's even got a pair of scissors if you need to cut the shirt. Okay, go ahead and take the pads.
Okay. I was waiting
When
for it to say
patient's
something.
chest is bare, remove protected. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly the patient's bare skin.
Cece follows directions.
I do. That's
Pad has been
Take
placed.
the next pad.
Look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown
Yep,
in the
just like
picture. Press. No one should touch the patient.
At this point, you just want to make sure nobody's touching the patient. Everybody's clear. And you always see that on the TV show.
No one should
You know,
touch
right?
the patient.
Where they shock.
Analyzing. Shock advised. Stay clear of patient. Shock delivered. No one should touch the patient. Analyzing.
These are great.
Very easy to use.
No one should touch the patient.
The voice is
Shock
very
advised. Stay
Just
clear
listen to
of
the voice.
patient. Shock delivered. No one should touch the patient. Analyzing.
And now you would just go straight into the protocols have changed since I
No
purchased
one
this
should touch the
AED,
patient.
and this one goes
Shock
into the rescue
advised.
breathing.
Stay clear of patient.
But,
shock delivered.
Today you will just go straight into the
Be sure
compressions.
emergency medical services have been called. It is safe to
Okay,
touch
so it's safe to touch the patient. So
Check
Cece, let's go ahead and start
Check
compressions.
breathing.
Okay,
Check
so-
circulation.
Just-
if needed, begin
not breathing.
CPR.
Yep.
For help with CPR.
Now you're kind of
press
standing
the
over, so come
flashing
to the side.
blue
Stand to
button.
the side.
Yeah, because you would have
You
a
want full
torso.
recount. You put your whole body right over him. Bump, 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 bump. As hard as you can. Keep your arms locked. Now, I just bend at my waist.
45 seconds until analysis will resume.
Just go ahead and do the CPR. And then it will tell you when to stop because it wants to reanalyze the rhythm to see if it needs another shot.
Okay.
30
Keep your
seconds
arms nice and
until
long.
analysis will resume.
Is hard enough? I'm really pushing.
Yep, you're doing good.
Hear the air moving.
15 seconds until analysis will resume.
It's hard,
No
isn't it?
one should
Yes.
touch the patient.
Okay, so now
Analyzing.
now it's going to check to see if it needs to shock.
How does it know it's not touching it?
It's analyzing. The pads are still on the patient.
Oh, they are.
Yeah, you
Shock
leave the.
advised.
So now it wants to
Stay
shock the
clear of
patient.
patient.
So now you
Press
would
the flashing
come back.
Press pad firmly to patient's bare skin. No one should touch the patient. Press pads firmly
So
to
my pads
patient's
are getting
bare
cold.
skin.
Okay, but in theory,
So in theory, the pads stay on this whole time.
Yes, pads stay on the whole time. You never take the pads off.
Analyzing.
Okay. And it's that simple.
Yeah. Just do it. Yeah.
I'm already
No
like,
one
oh my
should
gosh.
touch the patient.
So in the hospital, we change when we do CPR in the hospital. We change compressors. People that are compressing just every 2 minutes.
Because you run out of
Yeah.
Because it's tiring. Doing CPR, doing it properly is very tiring, and you will break a sweat very quickly.
I'm already. It's just because I kept going, trying to do the song in my head
Right.
as I'm doing
Bump,
it. So,
bump,
you
bump.
know.
Staying alive, staying alive. Yeah, and then going deep, and then getting a full recoil to allow that heart to fill back up with blood. So you go push down hard, and you come back, and you take all of the pressure off. That allows the heart to fill back up with blood. And you're doing that at 100 a minute, and yeah, you break a sweat really quick. It gets very tiring. So,
All right.
and then we're close to the fire department, so it should only be a couple minutes for the fire department to show up.
Okay. All right.
So.
Very good.
That's in a nutshell. That's how easy it is. The AEDs are ours. You don't have to worry about grabbing one. You don't have to have any fear of using one. And that's what this is all about. It's like,
You can do it.
yeah, it's nerve-wracking being in that situation. It's like, oh my God, what am I going to do? But don't say, oh, I don't know how to use it. I'm not going to try.
Right.
So the whole idea is to try.
Okay.
So if it happens to one of us, the other one runs out of the coach, over the pool, grab the thing, go back in, and start doing it.
Exactly. Exactly. While you're calling 911.
Yes.
And you don't even have to say anything to 911. Just put 911 on your speakerphone as you're running for the AED.
Yeah.
If you're by yourself.
Yeah.
If you're with a group of people, you want to make sure that somebody's going to call 911 and somebody's getting the AED.
Yes.
Right.
And you would start compressions until the AED shows up.
Okay. Let me make sure I have the hand thing right. It's like this.
It's right. So it's right between the nipples. Let's see if this is a nipple. Those are nipples.
Okay.
So you're gonna go 2, 3, 4, 5, 6, 7, 8. You're just gonna keep going.
Oh, okay, so you can do it from this way.
Yes, and that's how you'll be. You'll be off to the side. I put your entire weight up and then take your entire weight off. That's it. Perfect.
Hey, I think we'll call that a wrap. Hey, thanks for watching. We're sure to appreciate it. We'll see you in the next one.